Hi guys, how are you all? Hope you all are fine. Hope you all are enjoying. And may God bless you, God bless you, God bless you forever and always. Today I had prepared a topic which is called as a nephrotic syndrome, which I am going to tell you in short and all the basics. So, what is nephrotic syndrome? Nephrotic syndrome is a syndrome which is characterized by massive proteinuria, hypoalbuminemia, hyperlipidemia, hematuria, obesity, hypercoagulability, and hypertension. This is called as a nephrotic syndrome. This is a syndrome. So, n number of symptoms are there. So, it is called as a syndrome. What are the causes of nephrotic syndrome? The first cause is idiopathic, second cause is obesity, secondary to hepatitis B virus, secondary to hepatitis C virus, then SLE, syphilis, then thyroiditis, then amyloidosis, and diabetes is one of the main cause, congenital in children. So these were the causes. Acute glomerulonephritis, this is also one of the cause. Now what are the types of the nephrotic syndrome? First is the minimal lesion nephrotic syndrome and significant lesion nephrotic syndrome. The minimal lesion nephrotic syndrome occurs due to the uh, you know, due to the increased intake of the NSAIDs and Hodgkin's lymphoma. And the significant lesion nephrotic syndrome, it is divided into focal segmental nephrotic syndrome, membranous proliferatory or mesenchymal capillary, then then nodular glomerulosclerosis. These are all significant lesion nephrotic syndrome. In children, the causes are both primary as well as secondary. One more cause is there. It is called as the congenital. And in congenital, the cause is mostly genetic and the treatment is kidney transplant. So this was about the types of nephrotic syndrome. What are the clinical features? In children, the clinical features are the fever, fatigue, irritability, loss of appetite, loss of appetite, diarrhea, edema is the sign. Then due to proteinuria and hypoalbuminemia, there is a edema. In adults, there is a pre-tubulinemia, there is periorbital edema. Okay, there will be frothy urine because passing of fats in the urine. So edema is the main in the nephrotic syndrome. Now we had seen the definition, causes, types, and clinical features. Now we will see after clinical features how we are going to investigate the nephrotic syndrome. The nephrotic syndrome is investigated by the urine test, by RFT, and this thing by ultrasound. Now what is the treatment of nephrotic syndrome? First is the high protein diet should be given, low sodium diet should be given to the patient. Then in the minimal lesion, the treatment is the drug of choice in the minimal lesion is the furosemide. That is the Lasix we give to reduce the edema. Also we give 20% albumin. Then albumin, because hypoalbuminemia is there, prednisolone, corticosteroids has to be given. So, and in significant lesion, we give ACE inhibitors, ARBs, prednisolone, and also we give immunomodulators like levamisole. Then we give anticoagulant and antiplatelet like pyrimidine and um, aspirin. We give a bolus of methylprednisolone in the significant lesion, and we have to give ARBs and AS inhibitors to reduce the hypertensions. Now what are the complications if the treatment is not, early detection is not possible and the treatment is not taken? The complications may be resulted. Like what are the complications? First is the this thing. First is the hypertension. There will be raised cholesterol. There will be hyperlipidemia. Therefore, there will be raised cholesterol. Then, due to raised cholesterol, there will be hypercoagulability, and this thing. And the complications like pneumonia. There can be renal failure. Renal failure is the most significant complication of the nephrotic syndrome. There will be pneumonia. Okay, there will be this thing, renal failure. So these were the complications of the nephrotic syndrome. So hope you liked the topic in short, and I had covered literally everything very shortly. And please like my channel and subscribe it. Thank you so much. Love you all.